Have you ever woken up in the middle of the night feeling that throbbing pain in your temples? Or perhaps you've been startled to see the numbers on your blood pressure monitor climbing higher and higher while the doctor shakes their head with concern. I know exactly what it's like to live with this constant fear, checking your blood pressure several times a day, carrying medication everywhere, avoiding joyful moments with family out of fear that the emotion might make your heart work too hard. Hypertension steals more than our health. It steals our peace, our freedom. And the worst part is hearing those same generic recommendations. Cut the salt, lose weight, take your medications, as if it were that simple, right? After years of helping people like you regain control over their blood pressure, I've discovered there are solutions that your doctors rarely mention. Natural, accessible solutions that really work. In today's video, I'm going to share with you 5 common medical tests that could be dangerous for people with hypertension. Information that has transformed the lives of hundreds of my patients. Imagine being able to gather with your grandchildren without worry, travel without fear of an emergency far from home, or simply wake up without that feeling of heaviness in your chest. This isn't just another empty promise. It's a proven path that you can start today with simple foods and habits that are already within your reach. So stay with me until the end, because this could be the most important video you'll watch this year for your cardiovascular health. Before we begin, I'd love to know if you or someone in your family suffers from high blood pressure. Leave a comment below, sharing your experience or any questions you have on the subject. And don't forget to subscribe to the channel and turn on notifications to receive more content that can transform your health. When we talk about hypertension, we're discussing a condition that affects nearly half of American adults. That's right, almost 50% of adults in the United States have high blood pressure, and many don't even know it. It's called the silent killer for a reason. You might be walking around with dangerously high blood pressure without any symptoms until something serious happens. This is why regular monitoring is crucial. But equally important is knowing which medical procedures might put you at increased risk when you have this condition. I've spent over 2 decades working with patients with cardiovascular conditions, and I've seen firsthand how certain routine medical tests can trigger dangerous spikes in blood pressure or even lead to complications in those with uncontrolled hypertension. While these tests are generally safe for the general population, they can pose specific risks for those of us managing high blood pressure. Let's start with the first potentially dangerous test: contrast CT scans. Computed tomography scans that use iodinated contrast media are incredibly valuable diagnostic tools. They help doctors see detailed images of your internal organs, blood vessels, and tissues. However, what many doctors don't discuss thoroughly enough is that these contrast agents can cause significant stress on your kidneys and cardiovascular system. For someone with hypertension, especially if it's poorly controlled, the contrast medium can trigger a sudden increase in blood pressure. The reason lies in how these substances affect your blood vessels and kidneys. The contrast medium can cause your blood vessels to constrict temporarily, leading to a spike in blood pressure that could be dangerous for someone already dealing with hypertension. Additionally, these agents can cause something called contrast-induced nephropathy in some patients, which means temporary or permanent kidney damage. Since your kidneys play a crucial role in regulating blood pressure, any impact on kidney function can further destabilize your hypertension. What's particularly concerning is that many people don't realize they have kidney problems until they undergo one of these tests. And the combination of unknown kidney disease and hypertension creates a perfect storm for complications.
If your doctor recommends a contrast CT scan, there are several precautions you should take. First, make sure your blood pressure is well controlled before the procedure. Second, discuss with your doctor about proper hydration protocols before and after the scan, as good hydration can help protect your kidneys from the effects of the contrast. Third, ask if there are alternative imaging options that don't require contrast agents. Sometimes an MRI without contrast or an ultrasound might provide the necessary information without the added risk. Finally, if a contrast CT is absolutely necessary, make sure your kidney function is assessed before the procedure and follow up afterward to ensure no damage has occurred. Remember, It's not about avoiding important diagnostic tests altogether, but rather taking extra precautions when you have hypertension. The second medical test that requires special attention if you have hypertension is the stress test, particularly pharmacological stress tests using medications like adenosine, regadazone, or dobutamine. These tests are designed to evaluate how well your heart works during physical activity and are commonly used to diagnose coronary artery disease. During a traditional exercise stress test, you'll walk on a treadmill or pedal a stationary bike while your heart rate, blood pressure, and EKG are monitored. For those who cannot exercise, medications are used to mimic the effects of exercise on the heart. However, these medications can cause significant changes in blood pressure. For example, adenosine and regadazone can cause a drop in blood pressure in some people while causing a spike in others. Dobutamine, on the other hand, typically increases heart rate and blood pressure as part of its intended effect. For someone with poorly controlled hypertension, these fluctuations can be dangerous and potentially trigger a hypertensive crisis.
What makes this particularly risky is that many people undergoing stress tests already have concerns about their cardiovascular health, and hypertension might be just one part of a more complex cardiovascular picture. I had a patient, let's call him Richard, who had moderately controlled hypertension and was scheduled for a pharmacological stress test. Despite mentioning his hypertension to the ordering physician, the significance wasn't fully appreciated. During the test, his blood pressure spiked to dangerous levels, causing him to experience severe headache and dizziness. The test had to be stopped immediately. While Richard recovered without permanent damage, his experience highlights the importance of careful consideration before these tests. If your doctor recommends a stress test, ask about alternative options like stress echocardiogram, which might provide similar information with less risk. Ensure your blood pressure is well controlled before the test, and make sure the supervising physician is aware of your hypertension. During the test, speak up immediately if you experience symptoms like severe headache, chest pain, dizziness, or shortness of breath. I want to take a moment to ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers from your exam, but how you feel living with this condition day after day. Many people tell me privately how isolated they feel, as if no one really understands the constant weight they carry, that silent fear that accompanies every heartbeat. If you identify with this, I would really like to hear about your experience in the comments below. It can be something simple, like, I've been fighting hypertension for X years, and what afflicts me most is your biggest concern. Sharing your story not only helps me create more relevant content for you, but also shows other people watching that they are not alone in this battle. Sometimes knowing that there is someone going through the same situation already brings immense relief. And who knows, your experience might be exactly what someone needed to read today to find hope. Now, let's continue our conversation about how we can transform this reality together. The third medical test that requires special consideration for people with hypertension is the common corticosteroid injection. These injections are frequently used to treat inflammation in joints, tendons, and other tissues. They're popular treatments for conditions like arthritis, bursitis, and tendinitis. While they're effective at reducing inflammation and pain, what many patients aren't told is that corticosteroids can cause significant elevations in blood pressure. This effect isn't just limited to the first few hours after the injection. It can persist for days or even weeks. The mechanism is complex, but essentially corticosteroids cause your body to retain sodium and water while excreting potassium. This fluid retention leads to increased blood volume, which raises blood pressure. Additionally, steroids can make blood vessels more sensitive to substances that cause them to constrict, further elevating blood pressure. I remember a patient, Martha, who came to me confused about why her previously well-controlled hypertension had suddenly become resistant to her medications. After some discussion, I discovered she had received a cortisone injection in her shoulder 2 weeks earlier for bursitis. Her primary care doctor hadn't warned her about the potential effects on blood pressure, and her orthopedist hadn't asked about her hypertension before administering the injection. We had to temporarily adjust her blood pressure medications until the effects of the steroid wore off. If you're considering a steroid injection, there are several steps you can take to minimize the risks. First, always inform the physician performing the injection about your hypertension. They might consider using a lower dose or a different type of steroid that has less effect on blood pressure. Second, make sure to monitor your blood pressure more frequently in the days and weeks following the injection. I recommend checking it at least twice daily for the first week. Third, consult with the doctor who manages your hypertension before getting the injection. They might recommend temporarily adjusting your blood pressure medications. Finally, consider alternative treatments for inflammation, such as physical therapy, non-steroidal anti-inflammatory drugs, if appropriate for you, or natural anti-inflammatory approaches like omega-3 supplements or turmeric. The fourth medical test that can be risky for people with hypertension is venography with contrast. This is a specialized X-ray procedure that uses contrast dye to visualize your veins, often used to diagnose blood clots, venous insufficiency, or to map veins before certain medical procedures. Similar to contrast CT scans, the contrast agents used in venography can stress your kidneys and affect your blood pressure. However, venography presents additional risks for people with hypertension. The procedure often requires you to remain still in positions that might be uncomfortable, which can itself cause stress and elevate blood pressure. Additionally, some contrast agents used specifically for venography can cause more pronounced vascular effects than those used in standard CT scans. For people with severe or poorly controlled hypertension, these effects can be dangerous. What's particularly concerning about venography is that it's often performed when there's already suspicion of a blood clot or other vascular problem. These conditions themselves may be related to or complicated by hypertension, creating a compound risk. I had a patient, Gerald, who needed a venogram to evaluate suspected deep vein thrombosis. His hypertension was usually well controlled with medication, but the combination of anxiety about the procedure, the uncomfortable positioning required, and the contrast agent caused his blood pressure to rise dramatically during the test. He developed a severe headache and nausea, requiring immediate intervention. Fortunately, the medical team was prepared and managed the situation appropriately, but it was a frightening experience for Gerald and could have been avoided with better preparation. If your doctor recommends venography, ask if alternative tests like ultrasound or MR venography might provide the necessary information without the use of contrast agents. Ensure that your blood pressure is well controlled before the procedure and discuss with your doctor whether you should take your regular blood pressure medications on the day of the test. During the procedure, practice slow, deep breathing techniques to help manage stress and anxiety, which can help keep your blood pressure more stable. After the procedure, make sure to drink plenty of water to help your kidneys flush out the contrast agent, unless you have been advised to restrict fluids for other medical reasons.
The fifth and final medical test that requires special attention if you have hypertension is the bronchoscopy. This procedure involves inserting a thin, flexible tube with a light and camera through your nose or mouth into your lungs to examine the airways. It's commonly used to diagnose lung conditions, collect tissue samples, or remove foreign objects. Bronchoscopy can be particularly stressful for the cardiovascular system for several reasons. First, the procedure often requires sedation, and the medications used can affect blood pressure. Some sedatives can lower blood pressure, while others, particularly if you experience anxiety or discomfort during the procedure, can indirectly cause it to rise. Second, the physical stimulation of your airways can trigger something called the vasovagal response, which can cause dramatic changes in heart rate and blood pressure. Third, the procedure often requires supplemental oxygen, and changes in oxygen levels can affect blood pressure as well. What makes bronchoscopy particularly challenging for people with hypertension is that many of the conditions that necessitate this procedure, such as chronic obstructive pulmonary disease, or COPD, or lung cancer, are more common in people who also have cardiovascular risk factors, including hypertension. I recall a patient, Sylvia, who needed a bronchoscopy to investigate a suspicious area on her lung CT. She had long-standing hypertension that was controlled with 2 medications. Despite informing the pulmonologist about her condition, her blood pressure wasn't monitored closely enough during the procedure. She experienced significant hypertension during the bronchoscopy, which led to a nosebleed, and the procedure had to be stopped before completion. She later required a second procedure with more careful blood pressure monitoring and adjustment of her sedation medications. If your doctor recommends a bronchoscopy, make sure to discuss your hypertension with both the pulmonologist performing the procedure and the anesthesiologist who will be managing your sedation. They may recommend adjustments to your regular blood pressure medications before the procedure, or choose different sedation medications that are less likely to affect your blood pressure. Request continuous blood pressure monitoring during the procedure, not just periodic checks. Practice relaxation techniques before the procedure to help manage anxiety, which can contribute to blood pressure elevations. After the procedure, have someone monitor your blood pressure as you recover from sedation, as this is a time when fluctuations can occur. Now that we've discussed these 5 potentially risky medical tests for people with hypertension, I want to emphasize that I'm not suggesting you avoid necessary medical care. These tests are important diagnostic tools, and sometimes the benefits outweigh the risks. However, being informed about potential risks allows you to take precautions and have meaningful conversations with your healthcare providers. There are several general strategies that can help minimize risks associated with any medical test when you have hypertension. First, always ensure your healthcare providers have a complete and current list of all your medications, including over-the-counter drugs and supplements. Some medications and supplements can interact with contrast agents or sedatives used during medical tests. Second, work with your doctor to get your blood pressure as well controlled as possible before any scheduled procedure. This might mean more frequent monitoring and temporary adjustments to your medication regimen in the weeks leading up to the test. Third, discuss with your doctor whether you should take your regular blood pressure medications on the day of the test. For some procedures, it's better to continue your medications, while for others, certain medications might need to be temporarily paused.
Fourth, make sure the medical team performing the test is aware of your hypertension. This includes not just the ordering physician, but also technicians, nurses, and anyone else involved in your care. Fifth, learn and practice stress management techniques like deep breathing, progressive muscle relaxation, or guided imagery. These can help keep your blood pressure more stable during stressful medical procedures. Sixth, consider bringing a friend or family member with you to medical appointments and procedures. They can help advocate for you and provide support, which can reduce stress and anxiety. Seventh, don't be afraid to speak up if something doesn't feel right during a procedure. Symptoms like severe headache, chest pain, vision changes, or dizziness could indicate a blood pressure problem and should be reported immediately. Finally, follow up with your regular doctor after any significant medical test or procedure to ensure your blood pressure has returned to your normal baseline. Living with hypertension requires vigilance, but it shouldn't mean living in fear or avoiding necessary medical care. By being proactive and informed, you can safely navigate the healthcare system and get the diagnostic tests you need while minimizing risks to your cardiovascular health. One thing I've observed over my years of practice is that the patients who fare best are those who take an active role in managing their condition. They educate themselves, ask questions, and work collaboratively with their healthcare providers. They don't just passively follow directions. They understand the why behind recommendations and can therefore make informed decisions when faced with new situations. This approach is particularly important when it comes to medical tests and procedures, where the standard protocols might not fully account for the unique considerations of hypertension. Beyond being cautious about the medical tests we've discussed, there are many positive steps you can take to manage your hypertension effectively. The DASH diet,
Dietary approaches to stop hypertension has been proven in multiple studies to lower blood pressure significantly. This eating pattern emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products, while limiting foods high in saturated fat and added sugars. Regular physical activity is another powerful tool for managing blood pressure. Even modest amounts of exercise, such as a 30-minute walk most days of the week, can make a significant difference. Stress management techniques like meditation, deep breathing exercises, or yoga can help keep your blood pressure more stable throughout the day. Limiting alcohol consumption and avoiding tobacco products are also important steps in managing hypertension. Finally, consistent medication adherence, if your doctor has prescribed blood pressure medications, is critical. Many people stop taking their medications when they feel good or their blood pressure readings improve, but this can lead to dangerous fluctuations and long-term damage to your cardiovascular system. Work with your healthcare provider to find a medication regimen that effectively controls your blood pressure with minimal side effects, and then stick with it unless your doctor recommends changes. Remember that controlling your blood pressure isn't just about preventing a heart attack or stroke in the distant future. It's about feeling better today, having more energy, experiencing less anxiety, and being able to fully participate in the activities you enjoy.
If you've made it this far, you probably know how difficult it is to live with uncontrolled blood pressure. That constant worry, the medications with side effects, the restrictions that seem to steal a little joy from everyday life. I want you to know that you're not alone on this journey. Our channel was born exactly from the desire to create a support community for people like you, who are seeking natural and effective alternatives to care for cardiovascular health. Each week, we share new discoveries, simple recipes that help control pressure naturally, and answer questions that doctors often don't have time to explain during consultations. If this content made sense to you, consider subscribing to the channel and turning on notifications. This way, we can walk together on this health journey, one step at a time, without rushing, but with the consistency your heart deserves. I don't promise miracles, but I guarantee honest information based on serious research and the experience of those who have already achieved real results. Take good care of yourself, and I hope to see you in the next video where we'll explore more strategies for living well with high blood pressure. Your heart thanks you for every small care you dedicated to it today. I want to close by reminding you that while hypertension is a serious condition that requires ongoing attention, it doesn't have to define your life. With the right knowledge, support, and strategies, you can minimize its impact and focus on living fully. By being aware of the potential risks associated with common medical tests and taking appropriate precautions, you're empowering yourself to receive the care you need safely. Remember that your healthcare team is there to help you, but ultimately you are your own best advocate. Don't hesitate to ask questions, seek second opinions when appropriate, and make your needs known. Your experience with hypertension is unique, and your approach to managing it should be tailored to your specific situation. The medical community continues to advance in its understanding and treatment of hypertension, with new medications, monitoring technologies, and management approaches emerging regularly. Stay informed about these developments, but also remember that many of the most effective strategies for managing blood pressure are the simple, consistent actions you take every day, the foods you choose, the activities you engage in, the stress management techniques you practice, and the medications you take as prescribed. By combining medical guidance with your own informed choices, you can achieve the best possible outcomes for your cardiovascular health. Thank you for spending this time with me today. Your commitment to understanding and managing your hypertension is a powerful step toward better health. I look forward to continuing this journey with you in future videos, where we'll explore more strategies for living well with high blood pressure.